Hello and welcome to Pregnancy Info. In this video, we will discuss if no labor pain after 40 weeks. The moment when a woman comes to know that she is pregnant, she eagerly waits for her baby's arrival and is ready to bear all the pregnancy complications too. If you are 40 weeks pregnant, you must be all set to welcome your little one into the world. But what if you do not show signs of labor at 40th week? Let's find out more on pregnancy at week 40 and what to do if there are no signs of labor. First, you have to know what is the normal time of delivery. As you enter the 40th week of pregnancy, you know that any day now your baby will be delivered. Hence, it is only normal to get restless, but there is no need to panic. The good news is that you are not the only one saving this spot. It has been observed that only 10% babies are born on their due date. Majority of babies are born between 37 and 41 weeks of pregnancy. However, twins or multiple babies are usually born before 37 weeks. Also, the due date given by the doctor is just an estimated date, and it may vary as your pregnancy progresses, depending on the growth and development of the baby. Some babies are also born after 42 weeks, though the chances are extremely rare. Therefore, it is very normal to be in your 40th week of pregnancy and still not show any sign of labor. What you can do about it? If you are reached the 40th week mark of your pregnancy and the signs of labor are nowhere to be seen, don't be stressed, as it will only postpone labor. Instead, try this. Number 1. Relax. Yes, you have waited long enough and these 2 weeks must be making you restless. But there is no need to panic or worry. The best you can do is relax and be patient. Try spending time with your friends or family members. Talk to them and enjoy some family time. Thinking about labor will only leave you stressed, which doesn't good, and you must be in a calm state to get ready for the delivery, which will happen any time now. Meditate. Meditation is a good way to calm and relax your mind and body. Meditations can also help you manage stress. Sit in an open space or natural surroundings, close your eyes, let go for all the thoughts in your minds and meditate. It will calm you down and also reduce the stress on your baby. Rest and sleep. The worst way to get over your worries is by sleeping and resting. A good 8 hours of sleep will relax and rejuvenate you anytime. When your baby arrives, your sleeping and resting schedule may go for a toss, so it is best to take as much as rest you can do. Indulge in your hobbies. Pursue your hobbies while you can, because once the baby arrives, you will have no time for that. It will shift your focus from the negative thoughts and feelings that you might be having during the pregnancy. Therefore, it may be a good time to indulge in your favorite hobby. Go ahead and read book, paint, sing, or listen to your favorite music. Climb stairs. It may sound a bit strange, but climbing stairs may actually help in inducing labor in the 40th week of pregnancy. Climbing stairs can put some pressure on the pelvic and might help trigger labor. Try acupressure. Acupressure is an old age therapy wherein one can bring about healing by pressing various pressure points located all over the body. In some cases, acupressure can help promote labor. According to the acupressure experts, there are 6 major acupressure points on the body that help in inducing labor. If pressed correctly, the signs of labor start within 1 to 4 days of the acupressure massage. Have sex. Yes, it is true. Have sex with your partner and soon your baby will be ready for arrival. The orgasm that you had experienced could help trigger the contractions, and the prostaglandin present in the semen could also help induce labor during the later stage of pregnancy. Try nipple stimulation. Although it is a bit uncomfortable, nipple stimulation could be one way you can induce labor. If you find it painful or uncomfortable, you can use a breast pump to do the stimulating action for you. Stimulating the nipples helps release oxytocin, a hormone that induces contractions, and hence you may soon go into labor. Spicy food. Everyone and their mothers suggest this one to be, but there does not seem to be any bit of science behind this. But try this, as it can cause labor induction. Evening primrose oil. This Homeopathic falls into the category of cervical ripening agent because it mimics prostaglandin. Unfortunately, it doesn't seem to be a very good job for it. Castor oil. Midwives have been using this trick for centuries. It even shows up in papyrus scrolls from ancient Egypt. The magic release on intestinal breakdown for the oil components to release of ricinoleic acid, which then hits up those prostaglandin receptors to get the labor ball rolling. Homeopathic sounds so much nicer than getting a Pitocin drip while stuck in a hospital bed. Unfortunately, the exact nature of mixing these herbal induction concoction may dull the effectiveness of a dose and render the usefulness of this consumption for labor rather possible to study. Membrane sweeping. This doctor conducted mechanical maneuvering, separates the membrane from the bottom section of the uterus, and works by stimulating local production of prostaglandins. It requires that a finger your doctor makes its way through your cervix to the other side, so it's no shocker that most women report discomfort. Hope-alling. Dates. Yeah, this one seemed weird to me. From an oddly specific study, women who ate 6 dates per day for the weeks leading up to their due dates were less likely to require medical induction. How is labor pain medically induced? There are several different methods that doctors commonly use to induce labor. One of the first steps is often to prepare the cervix for birth. The cervix is the opening or neck of the womb. It is tightly closed throughout the pregnancy. When the body starts preparing for birth, hormones make the cervix relax and become softer. A cervix that is ready for labor is sometimes called a ripe cervix. Hormones, especially prostaglandin, may be applied to the cervix in the form of a gel to prepare it for birth. It can be in the form of medicine that can be given by the intervals of 12 hours. They can also be used to induce labor contractions. Balloon catheter are sometimes used to stretch and open the cervix as well. When labor contractions start, the amniotic sac can also be opened to help things along. The amniotic sac is the fluid-filled bag that the baby is inside. It can be opened by making a small painless cut, a procedure known as amniotomy. Sometimes labor can also be induced with the help of a membrane sweep. Once a woman's water breaks, the amniotic sac cannot be closed again, so it's important that labor starts quite soon afterwards because the baby is no longer protected by the amniotic fluid. Induced labor doesn't cause any serious problem in most women, but they might have side effects. The main side effects of prostaglandins are gastrointestinal problems like nausea, vomiting, and diarrhea. Oxytocin can also cause water retention and other problems involving fluid balance such as low sodium levels. The risk of going past due date. Only about 1 out of 10 babies is officially overdue, which means that the baby is born after 42 weeks of pregnancy. Recent research has shown that delivery after 40 weeks may come with certain risks, and OB-GYNs have responded. Number 1. The placenta. The placenta's ability to provide baby with adequate oxygen and nutrients may be compromised. The volume of essential amniotic fluid may decline as baby grows. This increases the possibility of a pinched umbilical cord. The possibility of fetal distress increases, which can be made by different tests and ultrasound. The baby could grow too large to pass really through the birth canal, also known as macrosomia. The reason why the baby is overdue is usually not known. Sometimes it is because of a genetic predisposition or hereditary. Women who have already had a baby that come much later than their due dates are more likely to have an overdue baby in future pregnancy. Liver induction is mainly dependent on some factors which are considered by doctors. Some of them are described there in this video. How much overdue the baby is, how old the woman is, whether she has already given birth to another child, whether she smokes, how much she weighs, how big the baby is, and whether there are any signs that the child is in danger. What does induced labor feel like? When labor is induced, more tests are needed than usual, although these might be unpleasant. Overall, most women don't find this or other aspects of labor inducing induction particularly distressing. The relief of finally being able to give birth to their child often overrides other feelings. Some women worry that the pain associated with an induced labor might be worse than the pain associated with labor that starts on its own. But most women who are induced don't report a great deal more pain than women who have spontaneous birth. I have explained all about the problems related with labor or what happens if you have no labor pain. If you like the video, then like it, share it, and also subscribe my channel. And don't forget to give me feedback through comments. Thank you.